All right, today I'm excited to tell you about our reimagination of clinical healthcare software, which can significantly speed up doctors and make it easier for them to care for their patients. Over the past decade, the United States has undergone a massive transformation in healthcare from paper notes to digital. In 2008, 9% of hospitals had digital EHRs, and as of 2017, over 96% do. However, this transformation has not necessarily made doctors' lives easier. The first time I went to a doctor's office, and I'm sure other people have had this experience, and saw the doctor just look at their computer the entire time, it was a bit awkward. Now it's sort of just a commonly accepted norm, and we all sort of put up with it. But the fact is, this is horrible for patients, and doctors hate this as well. Nearly half of US physicians suffer from physician burnout, which has symptoms similar to depression. And studies have shown that dissatisfaction with software may be the leading cause of physician burnout in the United States. One of the problems doctors face every day is that writing patient notes is very difficult with current software. Software separates information across multiple pages and screens, and as doctors are writing their note, they have to constantly toggle between screens, copy information, memorize information, and parse long lists and tables that just don't contain the precise information that they need to write the note that they're writing today. So we asked ourselves, what if we could make this process easier? What if a computer could understand what the doctor is writing? And if a computer could understand what the doctor is writing, could the computer assist with the writing process and potentially show the doctor the right data at the right time? We spent the last 2 years working with doctors at Beth Israel Deaconess Medical Center to reimagine clinical documentation software from the bottom up. And we've actually been deployed for over a year in the emergency department there, and our software has been used in over 2,000 patient visits. Our tool consists of two main components. On the left side, we have a text editor where the doctor takes the clinical note. And on the right side, we have an attached sidebar where we reduce the fragmentation of the writing process and display information synthesized in cards. As the doctor types, our tool provides autocomplete, identifies clinical terms, and automatically displays relevant information in the attached sidebar. Now, I'll take a deeper dive into some of the features we've built for doctors, starting with those that help our tool understand the clinical note. The cornerstone of our tool is contextual clinical autocomplete. So as the doctor is typing, we predict ahead of time clinical terms that the doctor is about to type, and we've shown that this reduces keystroke burden on doctors. However, this also serves another purpose, in that it tells our tool exactly what the doctor is writing in the note and transforms a note from unstructured to semi-structured text. We also automatically highlight clinical terms, regardless of if the doctor is using autocomplete. This highlighting lets doctors quickly skim notes, and we provide them with the ability to correct highlights, which gives our tool even more insight into what the doctor is writing. Once we could understand what the doctor was writing, we added that structure to the note. Then we asked ourselves, how can we assist in the writing process? So based on feedback from doctors, we decided to augment our autocomplete with the ability to pull in relevant clinical data. So doctors don't have to leave the interface at all. They can construct a data-driven narrative inline by adding things like lab values as they type. We also utilize identified clinical terms to auto-populate the note as the doctors are writing. So here, the doctor has filled in the first section, documenting a series of conditions, and we can auto-populate later sections of the note based on those recognized conditions. Lastly, we asked ourselves, how can we show doctors the right data at the right time? To do that, we've created these synthesized cards, and as the doctor is typing, we will automatically display cards with relevant information. So here the doctor has typed hypertension, and without the doctor taking any action, we're displaying a card that contains cardiology notes and other relevant information for hypertension. Now, one of the key things here is the doctor doesn't actually have to do anything. There's no training. They just type as they always would, and we passively augment their experience. We've created a bunch of these cards. So here we have cards for lab values, where we have line charts, box and whisker plots, and we also showcase some of our richer cards, which contain multiple forms of information. So we have labs, reports, and notes. So what do our users think? We've seen a massive increase in usability scores, which means we may be able to lower clinical burnout. And users find that our tool makes them faster and makes it possible for them to find information in the writing process without having to navigate to different screens. If you're more interested, please see us at our poster session and help us transform healthcare. Thank you.